So a cold typically is it lasts about 3 to 10 days. Usually it starts with like runny nose, nasal congestion, maybe some postnasal drip, cough, sinus pressure. It's usually kind of like up here. It will last 3 to 10 days. Usually you don't have a fever, but you could have low grade temps. Even though you start feeling better within a week, you can have a cough that lasts up to a couple weeks afterwards. And it doesn't mean anything is wrong. It's just your body recovering from a cold. The cold can kind of be like a gradual onset. Like maybe you start with a tickle in your throat or a little bit of congestion and it progresses from there. Flu's more acute. Usually you start with muscle aches, chills, headaches, higher fevers. Some people feel like they've been hit by a bus or just exhausted. So it's a little more aggressive. And I would say like the fevers and the headache and the body ache is kind of the big difference. That's really a common misuse of the word flu. So I guess I would say like the stomach flu, that's more of a GI bug, nausea, vomiting, diarrhea. It is not the influenza, like the flu that we get the flu shot for. Flu shot is basically a vaccine. The flu shot is kind of like a educated guess at the strain of flu that we're going to have for the year. So it's not 100% sure thing. It is an educated guess, I would say. It's based off of data in other parts of the world. And we kind of give that deadened part of the virus and your immune system learns to fight it. So the idea is that if you're exposed to that virus, you actually won't get it because your body can fight it off. Or if you do get it, you're going to have a shortened course or a more mild case. No vaccine is a sure thing. We're trying to kind of teach the immune system how to fight something, but it's not for sure. It could be that you got a heavy dose of the flu. Maybe someone coughed right in your face and you got a lot of flu particles and it just kind of overwhelmed your immune system. And everybody's different. Our immune systems are different. Some are better than others. So I don't have a sure answer as to why sometimes you get it and sometimes you don't, but those are some theories anyway. We're living longer, we're having more chronic illnesses, so there's more people with heart failure, there's more people with diabetes. So we are probably like sicker as a population of people, and that makes you more susceptible to having things like the flu. So flu, it's more like symptom management. So ibuprofen, Tylenol, rest, plenty of fluids. I would say that's the mainstay of treatment of the flu. If you have, say you do have heart failure, have diabetes, or you're immunocompromised, there are medicines like Tamiflu that can be given, but they need to be started right away. So within 24, 48 hours of flu symptoms, they need to be started, and they can shorten the flu by about a day. So you kind of have to make that decision if you want to take it or not. Over-the-counter treatments, Dayquil, NyQuil, you can read the over-the-counter boxes and see what symptoms fit yours the best. But generally, ibuprofen and Tylenol can kind of help too with the pain or any sinus pressure.